Good afternoon, Hanson Robert. My name is Mihiraa. Let's start the warm-up session. What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. My name is Hanson Robert, and I'll be your nurse today. Could you please confirm the reason for your visit?
Well, it started a few days ago. I noticed that the whites of her eyes had a bit of a yellow color. Then I saw that her skin, especially on her face and chest, also had this yellowish tinge. She hasn't been her usual energetic self either. She seems more tired and doesn't want to play as much. I'm so worried it's something serious with her liver.
Thank you for sharing that, Mihiraa. It's completely understandable to be concerned. Based on what you've described and what the doctor has noted, the presenting diagnosis we are working with is jaundice. It's important to know that jaundice itself is a symptom, not a disease, and at this stage, we have no reason to believe it has spread to or is caused by a serious liver condition. We need to find the root cause. Could you share with me what your biggest concern or question is right now?
My biggest fear is that it's something like hepatitis or liver failure. I don't understand how a 5-year-old can get jaundice. I thought that was only for newborns. What is actually happening inside her body to make her turn yellow?
Mihiraa, I understand this is a worrying time, especially seeing the yellow color on Ashley. That is a very common and important question, and I want to provide you with a basic explanation so you understand what is happening in Ashley's body right now. Jaundice happens when a yellow substance called bilirubin builds up in the blood. Bilirubin is a normal waste product that is formed when the body breaks down old red blood cells. Usually, the liver is incredibly efficient and works like a filter, processing this bilirubin and clearing it from the bloodstream. However, when the liver is unable to process this bilirubin efficiently, the yellow pigment starts to deposit in the skin and the whites of the eyes, causing that yellowish tinge you've seen. You are right that jaundice is quite common and often harmless in newborns as their livers are still maturing. But when we see it in older children like Ashley, we take it very seriously because it usually indicates an underlying issue that needs to be found and addressed. Please know that we are moving quickly and decisively. Our immediate focus is to find the specific cause of this bilirubin buildup so we can start the correct treatment. The next step involves some important diagnostic investigations. This will primarily involve detailed blood tests to check her bilirubin levels precisely, assess her overall liver function, and look for any signs of infection or other blood-related issues. We may also arrange for an ultrasound imaging scan of her abdomen to get a clear picture of her liver, bile ducts, and other organs. While we arrange for these, we will be focusing on supportive care, ensuring she maintains excellent hydration and nutrition, as this directly helps support her liver function. We will keep you informed every step of the way, and we are working as a team to get Ashley the care she needs.
Okay, that makes sense. Is there anything I should be doing for her?
Yes, Mihiraa, absolutely. While we investigate, providing supportive care at home is essential for her recovery. The two most critical things are to maintain her hydration and ensure she gets adequate nutrition. This helps give her body the energy it needs to heal. It's also very important to monitor for any changes in her mood or if she becomes more lethargic than she is now. To help me understand her current state, could you tell me a bit more about her recent intake? For instance, how has her appetite been, and what has she been drinking over the last day or two?
She's been very picky. She'll only take a few sips of water or juice, and she's refused most of her meals. I managed to get her to eat a little bit of plain rice and yogurt this morning, but that's about it.
I appreciate you telling me that. It gives me a good picture. Now, as we manage this, it is vital that you know what signs to watch for that might indicate a complication. You should contact the clinic or seek immediate medical attention if Ashley develops a high fever, complains of severe abdominal pain, or shows any signs of confusion or unusual drowsiness that is hard to shake. To monitor her progress closely, we will also need to schedule a follow-up checkup. During that visit, we will repeat the bilirubin test to monitor the levels, assess her overall health, and gather vital information such as her weight, temperature, and a physical examination of her abdomen.
Okay, I will watch for all of that. Thank you for being so clear.
You're most welcome. To summarize our conversation for clarity, we've confirmed that Ashley is here due to jaundice, which is the yellowing of her skin and eyes. We've discussed that this is due to a buildup of bilirubin, and we've planned immediate blood tests and possibly a scan to investigate the cause. We've also talked about the importance of keeping her hydrated and nourished at home, and the key warning signs like fever and severe pain to look out for. We will also be scheduling a follow-up appointment to monitor her closely. Finally, to begin the process, Mihiraa, do I have your consent to proceed with taking a blood sample from Ashley for the necessary tests?
Yes, of course. Please do whatever you need to help her feel better.
Thank you for your consent, Mihiraa.